Welcome to the series seminar video tutorials Germanische Heilkunde by Dr. Rutgerd Hummer, MD. My name is Helmut Pilhar. I am the father of Olivia, and Dr. Hummer's appointed lecturer on Germanische Heilkunde, theory. This seminar video tutorial is about the sensible biological special programs of the breast. These special programs should help to solve a worry or dispute, or a separation conflict. I will explain the symptoms of the active phase, the conflict resolved phase, the crisis and the residual state, at the end of the healing phase. Several case studies are used to make the various associated conflict contents easy to understand. The objective is to learn to interpret the various symptoms of the respective phases correctly, such as breast cancer, sagging breasts, intraductal mammary carcinoma, mastitis, microcalcification, inverted nipple, etc. You can learn more about this in the approximately 1.5 hour seminar video tutorial. Ladies and gentlemen, I welcome you to this SBS seminar video tutorial on Germanische Heilkunde by Dr. Rutgerd Hummer, MD. My name is Helmut Pilhar. I am the lecturer appointed by Dr. Hummer for the Germanische Heilkunde, which is a great honor for me. Initially I was an engineer. I graduated from the Higher Technical School for Electrical Engineering and a second time for Mechanical Engineering in Wiener Neustadt. I worked as a software engineer. Since 1990 I have been married to my wife Erika, with whom I have 4, now grown-up children. We have also been grandparents several times. The cancer of our then 6-year-old daughter Olivia in 1995 led us to Dr. Hummer, and we became involved in a medical conflict that continues to this day. I have been teaching Dr. Hummer's findings since 1997. Dr. Hummer sadly left us in 2017. But he left us an important legacy. In my opinion, there is no more important knowledge than the knowledge about the correlations of how our bodies and psyche function. What could be more important than knowing how our bodies function? How do diseases arise, and what should I do for them to disappear again? What does materialism bring me, when I am physically and psychologically ill? Nothing. Right? But it also shows who our friends are, and who our opponents. And also that we are often our own enemy. Dr. Hummer has made himself immortal with this. Future generations will be grateful to Dr. Hummer for his discoveries, if we do not let this knowledge be taken away from us. And this has been attempted since the discovery in 1981. The question is, whether we will let this happen again, as it has happened in the past many times with other significant discoveries? This is the seminar video tutorial of the sensible biological special programs of the breast. The mammary glands are archaically outgrown sweat glands, and thus belong to the old mesoderm, the cerebellum. In the chart, this is indicated by the orange color but striped yellow, because it belongs to the old brain. Basically, we are dealing with 2 germ layers here. As mentioned, the old mesoderm with the mammary glands is the glandular tissue. Here the conflict content is a care conflict, or a nest-worry conflict. And the mammary ducts are lined with squamous epithelium, controlled from the ectoderm, the sensory cerebral cortex. Here the conflict content is the separation conflict. But also, the tissues of the possible and common follow-up conflicts will be addressed briefly. Breast cancer. Let's start with the mammary gland first. Here, handedness plays a decisive role. Hormone status also has an influence here. In this respect, I refer you to the seminar tutorial Hormonal Status. DHS. In the upper left of the small image, you can see a schematic representation of the cerebellum. This is from the top, as you stand behind the person. The whole backside is the relays for the dermis, so melanoma, shingles, etc. Near the arrows are the relays for the mammary glands. So, these belong to the dermis area, because they are converted sweat glands. So, the baby drinks the mother's sweat, refined from the developmental history perspective. That doesn't sound very tasteful, however, it is true. There are people who have not just 2 nipples, but a whole nipple row, like the pigs or dogs have. That goes up into the cheek. For example, I can respond with breast cancer in the cheek or waist. That goes down to the hip. Note that the man can also react with breast cancer. He too has nipples. That's because earlier humans were female. But then, I'm talking about hundreds of millions of years back. That is also evidence that we have gone through a history of development. For why would the dear God, insofar as he exists, give men nipples? Because it looks better, or to play with? Perhaps to pierce? Surely, that would be completely unnecessary then. Simply because we used to be female. The cause is the care conflict, when the child or the partner becomes ill. This is also easy to understand, because if more breast milk is produced, the child or the partner has a higher chance of survival. But it becomes difficult when it is also about the fight or quarrel. If your partner cheats, you can have breast cancer on your partner's side breast. You may wonder, why am I producing more milk? Because of a quarrel with my partner? If you think about it for a moment, that's also a kind of worry. If I didn't care, I wouldn't have the conflict. But for me it's important. Basically it's the same, also a nest worry conflict. For example, if the mother is put on the street with her children. Now that she has no nest for her children, she might react with mammary gland cancer. She is not worried about the child, who is healthy. She also does not argue with the child. But still, she has breast cancer on the mother-child side, because she has no nest for her child. This is also a possibility. Active phase. In the active phase, a compact lump develops. A hard ball then forms in the chest, creating a lump outwardly. And this is the biological sense. Through a cell division to produce more breast milk, to give the partner or child a better chance of survival. The healing phase, tumor growth stops only when the conflict is resolved. In the healing phase, there are always two options. With and without microbes. Without microbes is not biological. In nature I am always in contact with microbes. I have to make an incredible effort not to come into contact with microbes. Even today, some mothers carry around their disinfectant spray. Everything the child touches is immediately disinfected. That's an incredible effort. And such a child grows up in over-hygiene, and then at some point no longer has these microbes. That is non-biological. Actually, this is idiotic, a paranoia. The usual case is biological healing with microbes. Once you have the microbes, they stay for life. Antibiotics can't change that. If you were allowed to put your dirty finger in your mouth as a child, then you have the microbes. I still know today what sand, soil, and rotting would taste like. I've tested all of that. In the presence of microbes, the tumor is tuberculously degraded. Without microbes, the tumor remains encapsulated by the body with connective tissue. In this case it is not a problem, it is inactive, but remains for the rest of your life. At least until the next screening. At the latest there it will be discovered. The node, which normally would have disappeared long ago, if you had the microbes. Then they say, it's better to be on the safe side and cut it out. And then a little preventive chemotherapy follows anyway. That is all quackery. If one has the microbes, then in the healing phase, one has night sweats. Then at night, one has the pajamas and the bedding soaking wet. That is, with all the programs that are controlled by the old brain. So, the yellow and orange-yellow striped group. One always has the tuberculous healing there with the microbes. But not without microbes, of course, then the tumor remains. This sweating occurs in the deepest vagatonia. Such a healing phase usually proceeds over several days. One must then imagine the natural day-night rhythm, whereby I am less intensely vagatonic during the day than at night. One can then overlay this course over that of the vagatonic healing phase. Then one sees that the vagatonic healing phase is deeper at night. So at night, around 4 o'clock, one is in the deepest vagatonia. This is also the hour when most crises occur. Most children are then also born in the crisis of the pregnancy, at about 4 a.m. And then people also die a natural death in old age at about 4 a.m. And then you also have the wet pajamas. Usually without too high a fever, maybe half a degree. And that's a good sign. This means, fortunately I have the microbes, and I am in a healing phase now. I have managed to resolve a conflict. In conventional medicine, this is a suspicion of cancer. One is also exhausted with any tuberculosis, but that's all part of it. And if I know that, then I don't panic. But if I don't know, then I run to the open arms of the academic doctor. He's happy with that. For him, that's business. Wouldn't you be happy if patients walk through your door? Cyst after tuberculous healing. In the end of the healing, a hollow space with scar tissue remains in the breast, where the tumor was. This is a cavern. It is reinforced with calcium. This collapses, typically due to the weight of the breast. When fluid is retained, this cavernous cavity fills and inflates the breast. This is called a breast cyst. When punctured, water is removed and considered benign, because it is just water. I have never heard of malignant water with a high rate of cell division, so it is benign. But it does mean that I have a breast cancer program in healing. But fortunately, it passes for benign in conventional medicine. It also means, of course, that the patient has the kidney collection tubes closed with an active refugee conflict. Such a person feels left alone. We can interpret the organ level. She has a care-argument conflict and resolution, and she feels left alone. That is the actual meaning of cyst in the breast. Full breasts. It may be that this will pump up the breasts. If she is in a hanging healing and is constantly retaining fluid, then the small breast can be pumped full of water, and so she has permanently full breasts. But there is only tuberculous water in there. The baby doesn't like that either. That's watery milk, it doesn't taste good. Open breast. The conventional doctor likes to poke around. They want to see if they can tap into oil or stumble upon gold. In the end, they only find certain cells. But they work with the insane good and evil. There is no such thing in nature at all. Nature does not do anything good or evil, that is religion. If the doctor performs a biopsy, it is not uncommon for it to break through there, and then the pus runs out. The healing would be optimal if it drained from the inside through the lymphatic system. Now if it opens outward, that's not so tragic either. Pus and blood will be pouring out, and the problem is that it stinks like hell. It stinks like rotting flesh. That's what every tuberculosis does. And then you suffer the defilement conflicts and react with melanoma and various other conflicts. That's actually the major danger. For heaven's sake, don't get stuck in that. It is nonsensical to check whether the tissue is benign or malignant. And if it's conflict active or resolved, then I'd better get a brain CT. That's not anywhere near as invasive as puncturing. We don't need that at all. I will explain leprosy later. By itself, it's the dermis in a hanging healing, then the original tissue melts away. That can happen to the breast as well. So if the dermis reacts, we are basically dealing with the same tissue as the mammary gland. If I don't get my act together, the breast amputates itself. Then it rots, so to speak. But that's not the end of the story, because we humans have follow-up conflicts. The woman identifies with her breast, that is something very important for her. One can imagine that. Even I as a man can. If it rots away, it will not happen without follow-up conflicts. That's a big danger. Above all, don't have it punctured. What for? Benign and malignant do not exist. In a crisis, there is pain like knife stabs. Dr. Hummer also speaks of the typical pain of the cerebellum. For the dermis, the shingles also hurt. The shingles is a healing symptom and have knife-sharp pain in the crisis. Also, the formation of scar tissue gives knife-sharp pain. Of course, that also depends on the size of the conflict load. For example, if I resolve the conflict after a week, then I still have the healing phase symptoms for 1 week. In this case, rather needle sticks. But if I was active for 3 months, I struggled with healing for 3 months, which can hurt a lot. Then I go to a conventional doctor, and that's it. That's where it gets me. They scare me so much that I sign everything. That's their trick. The drying up of breast milk is not a conflict at all, but stress. Pregnancy also proceeds according to the Hummer's compass. The first 3 months are sympathicotonic, the last 6 months are vagatonic. And the birth is the crisis, and then comes the time of vagatonic breastfeeding. In humans, this would be 2 to 3 years. If the mother breastfeeds fully, even at night in 4-hour intervals, she will not ovulate. This is natural contraception. This is where nature says, you don't have room for a new baby yet. But if the mother then thinks, she has to go back to work as soon as possible. She starts to work again after 6 weeks. She has stress on the street, with the boss, and with customers in the company. Then she will come out of the vagatonic breastfeeding phase, and the breast milk will dry up. In nature, this would be certain death for the child. But thank God we have over it in our artificial society. In this society, we can replace everything plastic. It is also possible that the mother suffered a conflict during pregnancy. This conflict is put on hold by the pregnancy, until the first contractions. But then it becomes active again. This is to protect the mother and child. In nature, pregnancy has absolute priority. In addition, there is stress in the active phase, which stops milk production. This may also be the reason why the natural contraceptive method does not work. Lyme foci. The residual state of any tuberculosis is Lyme. Lyme foci in the lungs mean cleared lung cancer. Calcareous deposits in the liver mean cleared liver cancer. Calcified prostate means cleared prostate cancer. Calcified breast means cleared up mammary carcinoma. That's at the end of the healing phase. It can also be hanging healing, and then the calcium becomes more and more. Note, this is considered malignant in conventional medicine, a harmless Lyme. Have you ever seen malignant calcium? I haven't yet. Cavern. Here one can see this clearly. On the left X-ray is a compact nodule, and on the right is the cavern. This is what it looks like. That's where the tumor used to be. In conventional medicine, they called it spontaneous healing. That's where conventional doctors tend to believe in miracles. They officially believe in miracles. A council of doctors in Lourdes checks whether the person who has become healthy has swallowed any globules. If he swallowed a globule, it doesn't apply. That is what these doctors check in Lourdes. If he didn't swallow any globules, didn't do anything at all, just got well through a pilgrimage to Lourdes, these doctors submit that to Rome, and then it is officially recognized by the Pope as a miracle healing. There are now 80 of these. Conventional medicine officially believes in miracles. Dr. Hummer can explain these miracles. Fibroadenoma. Occasionally, one hears about fibroadenoma. This is not much different from mammary carcinoma, cleared by the microbes. A cavern remains, and this is nothing but connective tissue with calcium. I have connective tissue everywhere, in all organs and the lungs. The lungs are drawn yellow with glandular tissue, and red for the bronchi. But there is always support tissue, connective tissue is present as well. The scar tissue is also connective tissue. And with the aborted mammary carcinoma, the cavernous, of course, I will have scar tissue. And then that's the fibroadenoma, all totally harmless. But then the child has a name, and then one can make a protocol, a study, and a therapy out of it again. And of course, one can generate revenue again. Sagging breasts. If I get into hanging healing with that, the original tissue may melt away. In the SBSs of the old brain, slightly more cells are broken down in the healing phase than are created in the active phase. If this happens once or a few times, it is of no consequence. The special programs are basically made for a one-time pass-through, and not for hundreds. If that happens over and over again due to hanging healing, then the original tissue disappears. If that involves the mammary gland tissue, then the mammary gland disappears, and then one has the sagging breast, that is then basically an empty bag that collapses. The missing tissue does not grow after, either. The tissue that is missing is not there and stays gone. That's because we don't avoid the tracks. For example, the quarrel with the parents. The parents argue once a month, and the daughter comes into hanging healing. Worry about the mom, and worry about the dad. Every month there is a relapse. She reacts allergically to the parents' quarrel, with a recurrence. Then they reconcile, and she enters the healing phase. She then has sagging breasts. The real danger, however, is the subsequent conflicts. These include disfigurement and self-esteem collapse. There, the follow-up conflicts have caught the woman entirely off guard. With animals, you can see that these follow-up conflicts do not exist. There, the udder simply rots off. Case studies. Mama CA, mother-child side. A physician assistant takes mammograms all day long. One day, she noticed in herself a 4 cm lump in the breast. Knowing what to expect in conventional medicine, she went to the natural healer. The naturopath sends her to an introductory lecture on the Germanische Heilkunde. He sends her on to Dr. Hummer. And Dr. Hummer finds the conflict. On her mother-child breast, that was a worry about her sick mother, who had colon cancer. This 30-year-old woman was biologically wise. There are biologically intelligent people, she understood immediately. She made the following commitment. Should my mother have another recurrence, I will not let her go to conventional medicine again. Then I will treat her with the Germanische Heilkunde under duress. And that was the solution for her herself, and she came into healing, which was also very interesting. During the healing phase, she had a single epileptic seizure. This was because she had reacted not only with worry, but also with motor conflict. Unfortunately, I do not know how she convulsed, that is, which muscle groups were affected. That would have been interesting. She could have reacted with the arm or leg of the mother and child. However, it is more common to react to a single conflictual event not only with one, but often with several programs. Please note that the epileptic seizure has nothing to do with breast cancer, but does have to do with the cause, the mother's cancer. For her, Germanische Heilkunde was the general conflict resolution, so to speak. So, for her worry and her motor conflict. Also, what is interesting is, that she never noticed the paralysis of the motor conflict in the active and healing phases. So, the partial paralysis in the active and healing phases doesn't stand out so much, but the crisis does, which is the epileptic seizure. She had a pretty significant seizure. 6 months later she was pregnant, the boy is big already. Show me a case of breast cancer, who 6 months after the first cancer diagnosis, the woman becomes pregnant and gives birth to a healthy child. Show me that on chemotherapy. This woman has nothing to show for it. She has done virtually nothing academically, but she has been able to work causally. She was able to solve her problem, her conflict, by understanding Germanische Heilkunde. That is what takes the fear out of me. The oncologist's cancer verdict is like a court sentence. We take it fatally and think we must die. None of this is true at all. If one could call up such a patient and say, listen, there is still that, the Germanische Heilkunde, you are already in healing, there is nothing wrong. But no, the conventional doctors make firewood out of them. That's why I have to understand the Germanic, I have to understand for myself. I have to understand that I am in a healing phase. The conventional doctor doesn't make a distinction, he says I have to get treatment. Then I will get a second opinion, who then again says I should get treatment. Then I go to a therapist of the Germanische Heilkunde, and he tells me I don't have to do anything at all. Then I say, why? Are you crazy? I have cancer, and I don't have to do anything? If you don't understand that, then you are the drowning one. And to teach them how to swim in a short time is something that rarely works. If you don't understand it beforehand, then it's a pity. Mama CA, mother-child side. This husband writes, my wife was cured of her breast cancer with the Germanische Heilkunde. In May, my wife felt the first lump in the breast. I had heard of the Germanische Heilkunde. However, I was nowhere near ready to start the cancer treatment here. So we went to the hospital and made an appointment with Professor Dr. Oncologist. After an examination and followed by a biopsy, the diagnosis was malignant breast cancer. When I asked him about the cause, his answer was something like due to the environment, heredity, stress, smoking, etc. Moreover, we were not supposed to ask so much, but immediately make an appointment for surgery. Otherwise, my wife would not survive the next 4 weeks. Schedule F, that's how it always works. Short joke. Are two surgeons standing at the operating table? Says one to the other. Pooh, that was just in time, an hour later, and the patient had become healthy on his own. With the Germanische Heilkunde still in my memory, I called the study group leader. On the phone, he first reassured us and had us do the clap test. Then he invited us to the next study group meeting. Among concerned and interested people in Germanic, the cause and background of my wife's breast cancer were discussed. She had a son of 29 years from a previous marriage, who had slowly but surely drunk and smoked himself to death. One morning she found him dead in bed. A terrible shock. A deep soul conflict, which was confirmed beyond doubt by the brain CT. We turned with confidence to Germanische Heilkunde. We spent the following weeks together with the study group leader, my wife and me, to work through the conflict. With the knowledge of Germanische Heilkunde and the background and causes of breast cancer, the malignant tumor had shrunk to a little encapsulated lump, within 6 months. This is without any medical treatment. We thank the Germanische Heilkunde for a new life. For safety reasons, it is perhaps better not to publish the name of the study group leader. The study group leader at the time had to give up his study group, under enormous pressure and no uncertain threats. Do you see what kind of times we live in? I know it only from my father's stories, that's the time we live. If there are multiple lumps on the left breast, it means that she was caught off guard several times with her son. It was not one event with her son, but several. If I recognize the cause, it is, danger recognized, danger averted. The son is dead and stays dead, and I can then resolve it mentally. That I recognize it, in the trend of yes, that happened. That was the care of my child at the time, of my stupid son. But before I go through it myself now. Period. That was his life, and I have mine. That one somehow comes out on top. How does one resolve conflicts? There is no schedule F there either. The conventional doctor makes it easy for himself. Breast cancer? Chemo. Lung cancer? Chemo. Liver cancer? Chemo. Mama CA, partner side. This 17-year-old, left-handed woman falls in love with her horseback riding teacher. The teacher backed down and wanted to end this untenable relationship. He sold her horse. She said, it broke her heart at the time, and she went into psychosis. She went crazy. One completely spins for the first 2 to 3 months, when one enters the constellation. Then one can quickly end up in psychiatry. That is the constellation of territories, which is something wholly different again. Because of the psychosis, she came to Dr. Hummer. Dr. Hummer saw in her brain CT that she had also reacted with breast cancer. She didn't know that at all. And a few weeks later, she could actually feel the lump. She even had it diagnosed conventionally as malignant. But of course, she already knew why and got over it. She has the lump to this day, and she is now 35 years old. She says, "The bump doesn't bother me, I can feel it. It's just a part of me." It's interesting that she doesn't have microbes, despite being in an equestrian center. It's also easier to get them when you're still little, because then you put everything in your mouth. As an adult, you don't do that as quickly. She obviously grew up with excessive hygiene. Mama CA, mother-child side. This case ended in a disaster. It involves a 35-year-old right-handed woman. The upper node is a struggle with her mother, and the lower one is a worry about the child. She has it on the left mother-child breast and accordingly 2 Hummer foci in the cerebellum on the right side. When she resolves the worry for the child, the lower lump disappears. When she resolves the argument with her mother, the upper lump disappears. When she takes care of the child again, the lower lump is reactivated. Each part is associated with one person. She already had them both in solution. She gets involved in a new relationship and moves into the man's house. She puts the child to sleep in the living room. In the bedroom, she takes off her clothes. The man sees the lumps in her breast and shouts, "You whore, you are sick." And he throws her on the street. Together with her child, she had to walk several kilometers through the night to a cab park. She said it was so humiliating, and she responded to both lumps with melanoma. That one there on her breast associated with the mutilation. About these 2 melanomas, she then did not resolve the conflict and died of debilitation. That cost her life. You have to handle a cancer patient with velvet gloves. One wrong word or phrase, and it ends in disaster. And watch out for your family members. They don't know a thing. You want to go the way of the Germanic and are in bed with the healing with bone cancer, that is accompanied by pain. These then come to you and say, "My God, you're dying. Do something. I can't stand it like this." Hummer is a miracle healer. And with that, you have your follow-up conflicts. We really have to hide as patients, go underground. That is all unbearable. Mama CA, mother-child side. Dr. Hummer writes, "One of my patients had 2 tumors in her breast. The breast tissue belongs to the cerebellum. The woman had 2 conflicts, a mother-child conflict and a daughter-mother conflict. So, about the child and about the mother. She was expecting a child out of wedlock, whose father suddenly denied paternity. He demanded an amniocentesis, a puncture to extract the amniotic fluid. This examination caused the woman to panic. She was afraid that her child would suffer a deformity. The paternity processes became involved in the conflict. They all had the same content, it was all about the paternity of the child. The puncture served to determine paternity. The conflict with the mother was protracted and lasted 15 years. This is then usually transformed down. There were fights, nothing serious, but they were not settled, and the associated lump grew 2 to 3 millimeters every year. By the way, the tumor caused by the mother-child conflict leads to increased milk production. A sensible biological specialty program with the aim of having more breast milk for a child who is sick and thus helping them get healthy faster. Mama CA, twice on partner side. This 45-year-old, right-handed woman is building a house with her husband, next door to her parents. That took a year, and the garden was ready after a year. She had laid it out and was constantly on the building site. The first floor was planned for them, and the upper floor for their son. When the house was ready, the parents-in-law came, who were around 80. They said they would like to spend their last years near their son. Whether they could move into the ground floor apartment. She agreed to that. The in-laws had also agreed to contribute financially. They had a good relationship, and she lets them move into the house. But then the in-laws did not like that, and that had to be changed. And they did not contribute financially either. The visits became fewer and less, and one day she discovered a lump in the breast. She goes to the conventional doctor, and he sends her for a mammogram. Shortly before the mammogram, she was at a seminar with me. And there, she had then understood that her quarrel with her in-laws caused the lump on the partner side. Then she was at the mammogram, and oops, 2 lumps. That was the quarrel between father-in-law and mother-in-law. But she knew the magic name and changed her attitude. It's just a matter of time, that was the solution for her. She came into healing, and she had night sweats. She said that she had to hold on to the toilet bowl at night so she wouldn't slip, because she was so wet and sweaty. Mammary gland line. This is a mammary gland cancer of the mammary gland strip. This is a left-handed girl who is 15 years old, and was abandoned by her boyfriend. She is left-handed, so the left side is the partner's side. When that opens up, pus runs out. Basically, it's the same as the plague. Plague is also a dermis program and smells like bubonic plague. Both breast carcinomas. This woman has really full breasts. You can see that on the X-ray as well. Dr. Hummer has marked the cavernous area with a dotted line. When you poke it, the pus runs out, and there is an opening. It stinks and can be a disaster, because of the follow-up conflicts. Their problem was that their parents fought once a month. They needed that. She then sat between them and worried about the father, and worried about the mother. Every month another recurrence, and then they made up. And so, she got into the hanging healing of the mammary glands on both sides. She retains fluid, and that pumps up her breasts. Then, she will get saggy breasts when she moves out of her parents' house, and no longer triggers her track. Even if she resolves the kidney collection tubule conflict, she will get saggy breasts. Mama CA mother-child side. How knowledge keeps you calm. A 27-year-old, right-handed mother writes. In February 2014, my youngest daughter Amalia, age 1, clung to the hot stove with both hands and stayed stuck. As I took her hands off the stove, looking at her palms, I thought, shit, they're well done. We were then admitted to the hospital together. Since my husband and my older daughter of 3.5 years couldn't visit us every day, my husband brought the tablet, so we could at least make video calls. During my first few days in the hospital, I noticed a small lump in my left breast. Since I was still breastfeeding, I didn't think anything of it. I thought it was curdled milk. I couldn't sleep at night, because my thoughts were constantly revolving around the accident and my suffering child, as I lay isolated and alone in this hospital bed. That is typically the conflict active phase, compulsive thinking. The brain searching for a solution. So, I took the tablet and read my emails. Among them was a testimonial. Because I had time, I took a closer look at the Germanic and happened to read that a right-handed woman would get breast cancer in her left breast, if she nursed her mother or child. I reached for the small lump in the breast, and my mouth fell open. I was so surprised by it, that I continued reading and relatively quickly ordered the first book. Even though some torture still awaited us, fortunately I was able to resolve the conflict after the first hospitalization, and the lump soon disappeared. Would Amalia not have had this accident, I would probably not be so intensely engaged with Germanische Heilkunde. I would not be so relaxed if one of my children was ill. Here, conventional medicine can do an excellent job. Emergency medicine can be used and should remain so. Conventional medicine had helped her to solve this conflict. By helping her child to get well again, I can also acknowledge that. If I had an accident and broke my leg, why not use conventional medicine? But they can keep everything else. Mama CA, mother-child side. This right-handed, 45-year-old woman had a nest worry conflict about her children. What was the case? Her husband was a Casanova and spent their money on other women. In her distress, she had started making flower arrangements and selling them on the street. The business was flourishing. She was able to rent a small warehouse for herself. But then came the competition, and the clientele declined, and in a short time she could no longer pay the rent for the space. The landlord threw the flower arrangements on the sidewalk, and passers-by stepped on them. Seeing that she suffered the conflict on the mother-child side, because she had done all that for her children. That was her breast cancer on the mother-child side. Mama CA, mother-child side. A right-handed, 55-year-old woman has had a 2-centimeter lump in the left breast for 2 months. This was diagnosed conventional medically. She had a daughter, but with that, she had no problems. This one is studying and is not here. A year ago, her 7-year-old dog had its tartar removed by a veterinarian, who also studied dentistry. The dog died as a result of the anesthesia. The vet told the patient in tears. 6 months ago, she got another dog from the animal shelter. 3 months ago the dog suffered a stroke, and she had to go to the vet again. When the patient spoke about this visit to the veterinarian, she involuntarily took a step forward, as if she would otherwise have fallen. This was apparently her conflict, caring for the dog. A month later she had the lump. A day after this conversation she reported that the pain had subsided. She apparently suffered a conflict when she had to take the new dog to the veterinarian again. This is seen from the previous event, where the vet had killed her dog. She had fallen over, almost right at my feet in the process. I suspect that she suffered the care conflict for her dog in the process. Mama CA, mother-child side. Then there is breast cancer in the man. This right-handed, 50-year-old man is a closet of a man, with broad shoulders and colossal head, and an absolute softie. One rarely sees something like that. This one apparently must have had the territory free of conflict for up to 25 years. Then you grow into a solid man. Then he must have been cerebrally castrated and turned into a softie. That exists too. He is a medical masseur. But his wife had hairs on her teeth, she's a real male woman. He says he has a bosom that many women would envy. And he has had a lump on the mother-child side since childhood. It often hurts. He had a conventional doctor examine him once. He wanted to send him for a mammogram, says the 50-year-old. For all that is right, but I'm not going for a mammogram. So, he must have had a worry argument conflict with the mother, that's what he says. He was 4 years old, when he climbed into the hayloft in a total panic, because he thought his mother had hanged herself. He was 4 years old at the time, that's what he said. An hour later he says he has to leave quickly, because he has to take his mother to the train. He says, yes, I will not let my mother hang. So, there was a conflict with his mother from childhood. He has had the lump since childhood. Mama CA, mother-child side. This right-handed, 40-year-old man also had breast cancer on the mother-child side. And it was because his wife was cheating. She was a nymphomaniac, and she had introduced him to her sweetheart every time. So in the trend of, look what a nice man, he then knew that she had gone to bed with him. She hadn't looked after the children. And that was his worry, because his wife was not taking care of the children. Then he met his current wife, with whom he also has a child. That was the solution for him. Now he has a mother for his children. In the healing phase he developed a huge lump, that popped open, smelled, and festered. This lasted for many months, during which he kept thinking it was an abscess. He didn't worry about it any further. Then he was with Dr. Hummer, and he read his brain CT and saw that he once had breast cancer. All that has been 15 years ago or more. Scars remain in the brain, as they do at the organ level. One can then tell from that decades later. When Dr. Hummer read your brain CT, he could tell you all kinds of things about your childhood, things you had never talked about with anyone. Dr. Hummer read that from the brain CT. It's amazing. Mammary gland CA in a dog. Dr. Hummer always had boxer dogs. Once brother and sister allowed themselves to provide offspring. Incest. The mother, of course, did not tolerate the daughter raising young. The mother is the alpha. It came to a battle between mother and daughter. The daughter won. The mother suffered a conflict and died of exhaustion. She was unable to resolve the conflict, because the daughter was stronger in the end. However, the daughter had also reacted with T carcinoma. It was a tumor, the size of a tennis ball, on the mammary gland. When the mother died, this was the solution for the daughter. Note, often, the death of the person with whom I have the conflict is the solution for my conflict. That all sounds very violent, but it is very biological. It's simple like that if you think about it. I wish your mother-in-law a long life, but one can also become healthy if she dies. The boxer's lump didn't open, but broke off from the inside. Boxers especially, if they have suckled before, have these thick fat nipples. Those are as thick as your little finger. And where the tumor was, that was like a triangle, there the nipple hung lower. If you touched it, you could see the cavern, this hollow space with scar tissue. The lump had broken off completely, was utterly gone. It had become healthy spontaneously. Mammary gland cancer in sheep. An acquaintance of mine always has about 2,000 to 3,000 sheep. So, he also has 2 or 3 mother sheep, where the nipple is rotting away. Sheep typically have 2 nipples. And after the mammary cancer resolves, then the blood vessels hang free and open. Not everything rots away, and the blood vessels remain, for example. They are also another tissue, which is the orange group. He then worries if they will get stuck behind something and catch the exposed vessel and then bleed to death. However, that doesn't happen. Further he says, they stay in the flesh well. They apparently have no follow-up conflicts. The sheep probably also think, the ram takes me with 1 nipple just as well. But the human woman whose breast rots away has additional conflicts, but the animal does not. So, that is typical of humans. Mammary gland cancer in goats. Another acquaintance of mine sells goat milk. One day, he calls me and says, there are increased cells in the milk, those are dead cells. That is inferior quality, and he gets no money for his goat milk. What could be the cause of that? At the time, I tipped on the milk ducts, the squamous epithelium, as it is ulcerated. Meanwhile, I know it is the tuberculosis of the mammary glands. In any case, I thought of a separation conflict. I ask him, where are the little ones? Says he, this goat species gives milk without ever having given birth. The little ones would also drink the milk away from him. He has no little ones. Next, I wonder if the goat been separated from a partner. Where's the billy goat then? On the other side of the fence, I don't want it near the goats. I suggested that he lets the billy goat with the goats, then if you don't get any money for the milk, at least you'll have lambs. He left the one billy goat with 130 sexually starving female goats, and it was a beautiful billy goat. This was a magnificent goat. He had straight antlers 5 feet long, and he had to hold his head at an angle to get through the gate to the pasture. The billy goat bucked for a week, continuously for 1 week, and then dropped dead. He died of exhaustion. That's a pleasant death, isn't it? 130 sexually starved goats. Phew. But he wouldn't accept another opinion from me. Cancer Society, quote. Breast cancer, causes and risk factors. As with most cancers, the actual cause of breast cancer is unknown. Alcohol consumption, obesity, low physical activity, high-fat diet, smoking. What smoking might not be causing? Breast cancer, lung cancer, all caused by smoking. Health Forum. Here they have analyzed nurses with breast cancer. It has been found that those who work night shifts are more likely to have breast cancer than those who work day shifts. Now they suspect the neon light to be carcinogenic. That ties in with a study that found that blind women have a breast cancer risk reduced by up to half. One can actually derive preventive breast cancer therapy from that. Cut out women's eyes, thereby preventing them from dying of breast cancer. Bild, September 1, 2007. House cleaning is good for breast cancer. What, you do have breast cancer? Don't you ever do any cleaning? I can well imagine that the editors-in-chief are laughing their heads off. Der Spiegel. Vomiting in pregnancy reduces the risk of breast cancer. ORF- September 20, 2010. Prophylactic removal of the breast also had an effect. In no case did breast cancer occur in these women. Well, really? Not to be believed. One didn't think that was possible, did one? That is all nonsense in a square. Welt, June 7, 2017. We need to redefine what breast cancer actually is. Doctors are rolling back breast cancer therapies. The current methods are apparently too severe. Some patients are even advised to leave the tumor alone and only observe it. And how is that with the prostate? And with colon cancer? Do we have to redefine cancer there too? That's all to cry about, isn't it? I think it's all to cry about. Hormone therapy. Now let's talk about something important for your understanding. You have to think along these lines. What if a woman has an argument because her husband is cheating, but does not react sexually? She would react sexually if she loved her husband. That's the sexual frustration conflict. If she thought to herself, that's not the fairy tale prince I had hoped for in my youth. Or if she has already thought about divorce and comes upon the fact that he is cheating. Then she does not react sexually but with violation of solidarity, with a quarrel. If such a woman is brought artificially into menopause, then she becomes a male, and she can no longer perceive this argument conflict, which is localized in the cerebellum, but now experience a male territorial conflict. The Hummer focus jumps up from the cerebellum into the cerebral cortex and into the coronary arteries cardiac relay. This is what we would see with the man if the woman were to cheat on him. The man has territorial behavior, and if the woman leaves, then the territory is gone. The breast cancer goes into solution, but she builds up conflict load in the heart relay. I searched on the internet and found something right away. There they have busullerin. Profact has the effect of blocking the production of sex hormones in the organism, in hormone-dependent tumors. Breast cancer is said to be hormone-independent, but how and why, they have no idea. Dr. Hummer explains it. You can read it in his books. A woman has been given 40 times more hormones than would generally be sufficient to make a man out of a woman. Out of the woman, they made a Superman. And this at a very good tolerance. The side effects in comparison are harmless, without leaving any traces. For a year, this woman was given a high dose of busullerin. And indeed the breast cancer became less and less. Finally, it was gone. Then they stopped giving the hormones, but what happens in the brain? Now she is becoming female again. The male territorial conflict becomes female worry conflict again, and the Hummer focus jumps from the cerebral cortex to the cerebellum again, and then the breast cancer comes back. But meanwhile, what is happening in the cerebral cortex and the coronary relay? In 2002, the patient died, not of cancer, but of a heart attack. That makes sense. It doesn't matter how I resolve the conflict in the cardiac relay, it works this way if I am using artificial hormones. I can use hormones to resolve, re-experience and add to conflicts. Messing with hormones is extremely dangerous, if I don't know what I am doing, and they don't know what they're doing. So, she died of a heart attack. However, it encourages us to continue with the gentle therapy. So, side effects are virtually innocent. Okay, she died, but otherwise, no side effects. Dr. Hummer would say, sorcerer's apprentices. They really don't know what they are doing. It is similar to the side effects of the birth control pill, the pulmonary embolism. A woman becomes male when she takes the pill. If she has an active female sexual conflict, and then she takes the pill, then she may no longer be able to perceive the sexual conflict from childhood, and the conflict resolves. Then in the crisis, she dies of pulmonary embolism, coronary artery relapse, because she no longer can experience this sexual conflict because of the pill. Melanoma, and now for a typical follow-up conflict. We are always kept perfectly in fear and panic by guided thinking. The posters with warnings about ticks. If you have a tick, you already have a problem. Or women are motivated to palpate their breasts regularly in the shower. Then, when she feels a lump, she feels disfigured and responds with melanoma in that very spot in the dermis. This happens very frequently. And that is only because of the fear-mongering of guided thinking. What also happens very often is that the woman feels disfigured by the surgery. I'm not a therapist, but sometimes I can't help but look at certain things. I have seen so many breast cancer treated women who were downright disfigured. In these women, the breast is patched. That looks destroyed by the surgery. These women then feel disfigured by the surgery and react to the scar with a melanoma. Melanoma on the surgical scar. It happens very often, and it happened to this right-handed woman of 50 years. Who was in conventional medicine with breast cancer, and somehow heard of Dr. Hummer. She thinks to herself, I will test this doctor out. With her husband, she flies to Burgau and lays down her brain CT before Dr. Hummer. Dr. Hummer asks her, and why are you coming to see me? Says she, Doctor, that is what I would like to know from you. She finally wanted to test him. Dr. Hummer reads her the breast cancer from the CT. It was on the partner side and involved an argument with the sister. Then in the dermis, he also saw an Hummer focus. He thought it would be on the scar from the surgery. He asked her if he could see it. Indeed, the scar had healed to a bright red bump. She thought it was an area that had not yet fully healed. But Dr. Hummer said it was a melanoma, and she had to resolve it as soon as possible. One has to resolve it, there is no other way. Actually, when she first saw herself in the mirror after the mastectomy, she thought to herself, that looks miserable. Ever since the operation, she had not shown herself naked to her husband. And every time she flipped through magazines or saw underwear, she thought, I can never wear that again. That was her disfigurement conflict. Still in Burgau, at the hotel, she says to her husband, now I will show myself to you naked. She goes to the bathroom and undresses, and enters the room naked. Her husband walks up to her, presses her into his arms, and holds her tightly. With that, the spell was broken, and the melanoma healed. Would the husband have reacted wrongly? Would he have said, that looks lousy? Then it would have gone completely wrong. Note, a cancer patient must be handled with velvet gloves. One wrong word, and it ends in catastrophe. And the conventional doctor pulls open the door and shouts, you know, you have cancer. You'd better get your affairs in order, you've got 3 months left. It's like a slaughterhouse. Lymph nodes. What also often happens is the following. The mother goes into the garden and sees her son lying motionless under a tree. Her first thought, he has fallen out of the tree. She then has a worry conflict for her son with breast cancer on the mother-child side. Simultaneously, however, she also blames herself, I'm a bad mother that this could have happened, which is a slight violation of self-esteem on the lymph node on the mother-child side. If she then dissolves that latter, there is a cell division in the lymph node in the healing phase, which is called malignant in conventional medicine. This is also the reason why one routinely cuts out the lymph nodes in women. This is because of the fairy tale of metastases. In conventional medicine, it is believed that the cancer cells of the breast go on a journey. This can only be done in two ways, through the blood or the lymph vessels. Next, one cuts out the lymph nodes in these patients. As a result, the lymph fluid cannot drain, and one reacts with a thick upper arm, which is forever. All this is equivalent to exorcism, to complete madness. Do not let all this happen to you. The best thing is not to go to a conventional doctor in the first place. At least not to have yourself diagnosed with cancer. Bone cancer. During the active phase, osteolysis, or osteoporosis of the bone occurs. If the bone marrow also reacts, the decreased hematopoiesis leads to anemia, with leukemia in the healing phase. The bones, the severe self-devaluation conflict. Thoracic vertebrae. When a woman is diagnosed with breast cancer, she may perceive it at the breast level. At this level, my body is not good. This is associated with the spine. At the same level, the vertebrae in her back erode. However, the osteolysis may also occur at the rib, where they are localized. Example: thoracic vertebra. That's what happened to this woman. For example, because of the diagnosis of breast cancer. So, according to the metastasis theory, the breast cancer cells have migrated into the bone tissue and metastasized there. However, the mammary glands have cell proliferation. They are malignant because cell proliferation occurs. And what do these migrating cells do in the bone? They make holes there. Yes, how does that work? They change the tissue, and out of glandular tissue suddenly becomes connective tissue, and instead of a cell increase, they now make holes. How is that supposed to work? Are they black holes into which everything disappears? It may all sound very logical, but we are left with little more than a fairy tale when we add the facts. But very dangerous fairy tales. You see, I am an engineer. You can lift any oncologist out of the saddle with a few questions. He will not be able to give you an answer. With my daughter Olivia, I was forced to always have a conversation with the doctor at the hospital before seeing my child. They had to judge if Mr. Pilhar wasn't freaking out, and I just asked them a few questions. Then I was banned from visiting, because I kept the doctors from working. But they were unable to give me any answers to my questions. If it all wasn't so incredibly criminal, then one could laugh about it. But it's not about laughing. It's about the lives of our loved ones. It's about our own lives. This is not for laughs. This is very serious. And you have to watch as they kill your loved ones and family on the assembly line. You can't do anything about it, because your loved ones are still stuck in guided thinking. The intraductal mammary CA. Next is the mammary ducts, which is the most common breast cancer. Outer skin diagram. We are here at the squamous epithelium, which is controlled from the sensory cortex of the cerebellum. The conflict course is according to the outer skin pattern, which means that it is numb in the active phase and the crisis, and hurts in the healing phase. Its counterpart is the gullet mucosa pattern, which hurts in the active phase, and the crisis, and is numb in the healing phase. Indication. Milk ducts are involved in 80% of all breast cancers, which is a healing phase. The squamous epithelium ulcerates in the active phase, and is not noticeable. It is repaired with swelling in the healing phase, and then the breast swells. It is noticeable, and that is the diagnosis of cancer. It's the same with bronchial cancer. Bronchial carcinoma is a healing phase. Urinary bladder carcinoma is a healing phase. Milk duct carcinoma is a healing phase. Cervical cancer is a healing phase. Those are all healing phases. They kill people in the healing phase. Those patients have warm hands and eat like a horse. They are in the conflict resolved phase. Also, they only need to be given morphine only once, to kill them in this healing phase. However, they have a cell division under swelling, which passes for malignant in conventional medicine. Which is something that doesn't exist. That is simply a matter of definition, they simply say it is malignant. Strangely enough, it is different again with the embryo, the fetus in the pregnant woman. The embryo also has a cell division, but it is not considered malignant. Although the tumor marker indicates that there is cancer. There are tumor markers that indicate that the woman is either pregnant or has cancer. If this tumor marker is positive in the man, he must have cancer because he cannot be pregnant. This is all a matter of defining. What is cancer anyway? How can I assign values to something, if I don't know that? DHS. As for the milk ducts, the cause is separation. Now there are two possibilities. I want to be separated, or I don't want to be separated. And that is again subdivided into partner separation and mother-child separation. The partner has torn away from my breast, or the child has torn away from my breast. That goes even if one introduces separate beds. I know a few cases of that as well. Those have responded with the milk ducts, because of separated beds. Conflict active phase. In the active phase, the squamous epithelium of the milk ducts ulcerates, which is also the biological sense. The biological sense. In this way, the milk no longer drunk due to the separation can drain better. In nature, the mother would constantly breastfeed. In addition, it is sensory numbed and insensitive according to the outer skin pattern. It hurts in the healing phase, but the active phase is numb. It is not noticeable. One also has an impairment of short-term memory, to forget the lost child as soon as possible. The healing phase. When healing, it is repaired under swelling and now hurts. Like all healing phases of the outer skin. This may be mastitis or intraductal breast cancer, depending on the extent of the conflict. How to distinguish between mammary gland cancer and intraductal breast carcinoma? For a beginner, it is difficult to distinguish. The mammary gland is a compact nodule that grows in the conflict active phase, breaks down under swelling in the healing phase, and thus becomes smaller if the associated microbes are present. In intraductal mammary CA, there are no symptoms in the active phase, except for the breast shrinkage due to cirrhotic contraction of the milk duct tissue. The breast then pumps up in the healing phase and becomes warm and sensitive. Intraductal mammary carcinoma is also much more painful. In the healing phase, mammary cancer gives a stabbing pain, called cerebellar pain. The crisis. In the crisis, we have the absence. We have the absence in every crisis in the squamous epithelium. If the active phase is numb, then the crisis is also numb. It does not hurt. Then you enter the second part of the healing phase, the swelling goes down, and the milk canals are open again at the end of the healing. The therapy. The therapy consists in massaging. If you can't do it yourself, you can ask your partner to do it. Whatever comes out. If blood comes with it, it's not a big deal. The important thing is that it comes out. If one does not, that is not a disaster either, but the breast becomes rock hard and small. If one massages it out, then it remains soft. Of course, follow-up conflicts can occur again, as the breast becomes small and rock hard. Of course, massaging it out hurts because it is sensitive in the healing phase. The main thing is that the secretions can flow away. Microcalcification. If this remains active for an undefined time, the milk duct shrinks cirrhotically. This is also the case, for example, in liver cirrhosis. The bile ducts are also lined with squamous epithelium. This involves a territorial anger conflict, and then the duct contracts. Then milk may remain in the milk duct, and the body absorbs the fluid. But then the calcium from the milk is left behind. That's microcalcium. Note that this has nothing to do with tuberculosis. There, the actual calcium deposits, the caverns, are affected by tuberculosis. This microcalcification comes from the milk. In conventional medicine, this is considered malignant. But in Germanische Heilkunde, it indicates that the conflict is still active, an active conflict of separation. The best thing to do is to resolve the conflict. Retracted nipple. If the milk ducts shrink in cirrhosis and are close to the nipple, then it can also lead to a retracted nipple. That's conflict active, and it's also numb, it doesn't hurt. As I said, the active phase is not often noticed. Syndrome. Then, if I have the milk ducts in healing, and they are repaired under swelling, I may also have the renal collecting ducts closed, and therefore retain extra fluid. This fluid then accumulates in the breast in healing, and that can cause a giant breast. The pain gets worse, and it lasts longer. Then one must see that one gets the kidney collecting tubes open again, thus resolving the refugee conflict. Or the bath with 0.9% salt content, see seminar video tutorial, kidney collecting tubules, then one simulates the worm-like being of our ancestor in us. It is then back in the primordial sea. Case studies. The Mecke phenomenon. Dr. Hummer calls this intraductal mammary carcinoma the Mecke phenomenon. Mecke is a goat my daughter found in a drainage pipe in front of Dr. Hummer's house in Spain. She had lost contact with the herd. In Spain, there is a law, whoever finds a goat can keep it. Dr. Hummer adopted the goat. A goat alone is also not wise and inhumane, so he got another billy goat. In no time, he had a goat farm. But that was ultimately the solution for Mecke. She had suffered a separation conflict when losing the connection of the herd. Now that she had a herd of her own, she resolved it and got an intraductal mammary carcinoma. Dr. Hummer tried to milk it out. That was maddening. Dr. Hummer could do a lot, but he couldn't milk. Then he arranged for a shepherd, and he milked it twice a week. That was all. That was the therapy. Period. It is done. And if it works in animals, why shouldn't it work exactly the same in humans? The animals simply have fewer follow-up conflicts. The humans panic immediately. Partner separation. This case is also hilarious. A married couple was seeing Dr. Hummer. She is a right-handed, 40-year-old woman with intraductal mammary carcinoma because of impotence. His conflict was that his ex-wife always lay in bed like a dead fish. Then he finally left him hanging. When his current wife also lies in bed like a dead fish, he leaves him hanging again. And because he couldn't sleep with her, she reacted with an intraductal conflict. At some point, it worked, and that was the solution. The therapy looked like this. To prevent him from getting on the fish track, she had to sit up in bed, and not lie down. And he had sucked out the intraductal mammary carcinoma in her to get in the mood. Dr. Hummer recorded it on camera. A soft porno. He would have loved to play the video twice at the seminar, that's how well he liked it. At times, with Dr. Hummer it was pretty funny. Hospitalization. Dr. Hummer writes a beautiful story in the breast cancer book, which becomes clear in retrospect. He had previously worked in a maternity ward. There the mothers came back to the hospital, one after the other with inflamed breasts. Then everything imaginable was done. One cut open the breast, looked for a hospital bacterium, and disinfected everything. Afterward, Dr. Hummer knew that it was, because they had all routinely mistreated these women. One had taken the baby away from them, right after birth. That was the separation conflict. Then they would have returned the baby and sent the women home. That was the solution. And in the healing phase, they were back in line for the hospital. In the end, it was the same routine abuse. One must always look for the common denominator in an epidemic like this. There is no such thing as contagion. That is nonsense, superstition. Mastitis, mother-child side. A biologist writes here. In the summer of 2001, after a difficult pregnancy, I spontaneously gave birth to my twin daughters Anna and Laura at 32nd week gestation. They were immediately admitted to the preterm intensive care unit, directly above the maternity ward, and I was with them as often as possible during the day and night. After 5 days I was discharged from the hospital, which I saw with a smile and a tear. A tear because I was no longer in the hospital with my daughters, and smiling because I could then be again with my 18-month-old son Nicolas, my firstborn. I had been separated from him during the delay in the clinic. In the following weeks, I went daily with the pumped breast milk to my daughters in the hospital. However, I also had to say goodbye to them again on a daily basis. After 3 weeks, I was informed of the date when my girls could leave the hospital. I looked forward to this immensely, to finally take them home. However, I was deeply disappointed. Because when I arrived at the hospital to pick them up, the head doctor told me that Anna had suffered a respiratory arrest at the overnight discharge check, and could not yet be discharged. Respiratory arrest is the diaphragm. The conflict is, I'm running out of breath, I can't get through this. In this case, because I'm crying for my mom. In the crisis, the diaphragm cramps, and then one has respiratory failure. Her twin sister Laura, however, I was allowed to take with me. I asked the doctor if both girls could stay in the hospital together. They had been together in my womb for 7 months and had been together continuously since birth in the incubator. I did not want them to be separated. My next 2 appointments to take my girls home were cancelled, both times due to the presence of symptoms at both of Anna's discharge appointments. The doctors also told me that Anna could only be discharged with a respiratory monitoring device. This then happened a day later. I was overjoyed to finally have my babies home. However, 1 day later I suddenly developed a very high fever out of nowhere, over 40 degrees Celsius. Simultaneously, my left breast became warm, red and hard, and began to hurt tremendously. A few hours later, the midwife who came for a home visit told me I had mastitis, because I did not pump all the milk out of the breast. Of course, I had already noticed that I had mastitis. But her explanation meant nothing to me and worried me. I also contradicted her, because it couldn't be that I hadn't pumped in full. After all, I had 2 babies to feed, and even my almost 2-year-old son would have preferred to drink with me. More than 12 years later, through Mr. Pilhar's seminars, I discovered the true cause of my mastitis. He explained in his seminar that mastitis is a resolved separation conflict. He also explained that in a right-handed woman like me, the left side of the body is the mother-child side. Everything he said made so much sense to me, and was so accurate that it brought tears to my eyes. She started crying right before my eyes, like a bolt from the blue. I am immensely grateful that I can finally understand what was really going on back then. I'm convinced that I would have been able to bear the pain much better back then if I had known the factual context. What about unpumped milk, midwife? And it's really true, the best pain relief is still to have understood the correlations. Then, when I know that I was conflict active for 3 weeks, and I'm already a week into healing, that it's going to take another 2 weeks. I'll manage that anyway. And a week later, I know it's only 1 more week, I can cross it off. But the patient who comes into healing, and it gets worse and worse, he gets desperate. The best painkiller is knowing these correlations. Udder inflammation one-sided. An acquaintance of mine has a small farm and 1 cow. The cow allows itself to be milked only by him. Now the farmer had to go away for a week. When he returned and milked the cow, it developed unilateral udder inflammation. I say to him, "Now you know if your cow is left or right hoofed." The cow does not perceive the farmer as a child but as a partner. Just get a cow to clap its hoof, it's not that easy. Suppose the clapping test does not show a clear left or right-handedness, but you have a special program that clearly focuses on the partner or mother-child side. In that case, you can determine the biological handedness in this workaround. Udder inflammation unilateral. A veterinarian writes, "She was a splendid woman, say milk sheep, with silky wool and numerous offspring. One day, my wife decided to remove the lambs at 12 weeks, because they would apparently gain weight better. This caused a terrible outcry in the barn. On the right, the mothers, annoyed. On the left, the lambs, screaming. But after 2 days, it was quiet. Only Grandma Molly called for her children at set distances again and again. My wife and I were satisfied, because now we could milk undisturbed and make cheese from the milk. But suddenly, our best sheep developed udder inflammation in the right udder. That we could not get under control, not even with the best antibiotics. After a while, we gave up trying to heal the completely clumped udder. Then we decided to let our darling mate again and bottle feed some of the lambs. We no longer looked at the udder. When I suffered from cancer and studied the findings of Dr. Hummer, it dawned on me that this udder infection was an udder cancer. The early removal of the lambs caused this. So, according to the 5 biological laws of nature of the Germanische Heilkunde by Dr. Hummer, Grandma Molly also had to have a so-called Hummer focus in the left cerebellum. She was left-legged, which one could recognize because she always swept her left paw into the trough when eating. How does one determine hooftiness in the sheep? By observation. With which hoof does she work more? I wanted to check it anyway, also to be certain. But where can I find a CT scanner where my sheep can be examined? Doing a CT scan of a sheep's brain is insanity in most people's eyes. Suddenly, I remembered old relationships. These work colleagues had an MRI scanner they used to examine pigs. So, why not our Molly? The former colleagues heard my explanations of Dr. Hummer's discoveries somewhat skeptically and incredulously. However, they were willing to help. So, Molly came down the tube. And lo and behold, in the left cerebellum, there was a beautiful half-moon-shaped Hummer focus. But I couldn't judge it well at all, because as Molly lay there on her back in the scanner, I saw a perfect udder. Without a lump and completely soft, only the milk duct was adherent. The explanation for this was simple. We had repeatedly left the lambs with their mothers, throughout the summer and subsequent years. With that, the mother-child separation conflict was resolved. As quickly as I could, I loaded my wonder animal onto the trailer, before any of my former colleagues would notice. They would have called me crazy. Because according to the prevailing doctrine, an udder changed in this way would never heal, and such an animal could only be slaughtered. According to the prevailing doctrine, one dies of breast cancer, and only morphine helps. Just put it to sleep before it comes to suffering. Glands and ducts, mother-child side. This 30-year-old, right-handed woman had both on the mother-child side active, mammary gland and milk ducts. Her mother was an alcoholic and often visited her uninvited. She then always wanted to instruct her daughter how to run her household. The daughter had reacted to this with argument and separation conflict. In the sense of don't hang on to my breast all the time. She wanted to be separated from her mother. So, she had run both programs. She had been treated conventionally and had her breast emptied, filled with her own tissue, and then resealed. And that worked. Only then did she find her way to Dr. Hummer. He was able to read in the brain CT that she had both programs running. This breast, of course, is insensitive, the nerves are shot through. However, as long as breast-conserving surgery is performed, you still have the best chance. That means no chemotherapy or radiation therapy, just surgery. If you don't mutilate but operate on the breast, you still have the best chances of survival, even in conventional medicine. Retracted nipple. However, this can also happen to the boy or the man. This is my 10-year-old, right-handed son. He is an avid snowboarder. When the class went on a ski course, they could choose between skiing and snowboarding. Then the class decided on skiing, and my son became stubborn and said that he would not go. But now, he was the only one who had to go to school. When the class returned, he had a thick areola on his partner's breast, and the nipple was still retracted. As I said, the active phase is not noticeable, and the healing hurts. So, he had reacted with a separation conflict on his partner's side, because he was the only one who had to go to school. The solution came when the class was back. Mother-child side. Now there is the phenomenon, where the older sister can perceive her younger siblings as her children, like a mother would. In this situation, the older sister locates her younger sibling, who is actually a partner, on the mother-child side. The story comes from a widower. His wife had intraductal mammary carcinoma, and they killed her academically correctly. She did not survive. They found their way to Dr. Hummer much too late. But what he found a little curious was, that she had breast cancer on the mother-child side. With the mother there was nothing, and they didn't have children. Until he read her diary, then it became clear to him. What was the case? When she was 7 years old, she had twin sisters. Usually 7 or 8-year-old children play with dolls, but she plays with her twin sisters. She already had motherly feelings for her little twin sisters at that time. Then these twins went on the wrong path, into the drug scene and prostitution. They finally moved away to a foreign country, to Paris. That was her separation conflict. But there must have been conflict resolution, because the introductal phase is the healing phase. Then he read the sentence. I don't want to have to play the mother anymore. With that, she overcame the conflict and entered the healing phase. With that, she had been destroyed in a medically correct way. Partner side in a man. This is a left-handed, 55-year-old man with breast cancer on his partner's side. He was abandoned in 1997 by his girlfriend, with whom he had been living for 9 years. The conflict probably arose in 2008, when she married his replacement and was already pregnant. Quote, my symptoms started shortly after my marriage in 2011, which brought me into a new and fortunate partnership. The nipple was very sensitive and itchy on the left side. There was occasional discharge. 3 months later, a lump developed, but it wasn't until 2 years later that it became noticeably larger and came out. I stupidly had it cut out, because it showed a reflection in the MRI. It was assumed to be an abscess, which could cause blood poisoning. All nonsense. Then he responded with a melanoma. What you see in the picture is a melanoma. That is only because of the mutilation. Had he not had anything done, it would have all been fine a long time ago. But now he's on the treadmill. Partner breast. This is also a strong case and very good for showing you what a conflict really is. A right-handed, 42-year-old woman works with her husband in a bank branch. One day a new employee arrives, a beautiful and highly intelligent blonde. She had already had a bad experience with a blonde once. A blonde had already snatched a partner from her once. Now, of course, she was allergic to blondes anywhere near her husband. Then the whole department went on a course. She was the only one who had to stay back in the branch. Now her husband was on a course with the blonde. Then he comes back from the course and tells his wife, it was great. With that, she had a complete relapse of the partner separation conflict. He falls to his knees in front of her and begs her, believe me, I swear, there is nothing going on with the blonde. But she was full of conflict. A few weeks later, the blonde comes and says she's resigning. She's getting married and moving out. And the patient, pooh. That was the solution, and she came into recovery with an intraductal mammary CA. She knew Dr. Hummer by then, and also knew her conflict and knew it was healing. She did nothing and got healthy. The actual conflict now was the blonde who had conquered her previous partner. This incident was only the beginning. She was about to set out. She thought that there was something between her husband and the blonde. That was the track. And when the blonde moved away, that was the solution. But the actual conflict was before that. He had sworn to her on his knees that there was nothing there. That could be a good thing too. She had an overreaction. Nothing needed to have happened at all. But for her, the track was enough to cause a recurrence. So, you have to be able to put yourself in people's shoes, have a little empathy. Not thinking so complicated, thinking simple. The trick is to be able to put yourself in the patient's shoes, and find out afterward what was happening in that person's head. Partner separation. This is about a 50-year-old, right-handed woman. Here one can see how the breast is getting smaller. This is an active separation conflict. There you can also see the Hummer focus in the cerebral cortex. So, it's not the cerebellum, it's the cortex. And the bumps you see are all defilements. She felt mutilation, and she reacted by defilement. That's the dermis, and those are all melanomas. So, ladies and gentlemen, that's all for this seminar video tutorial. I hope you learned something from it, and that it was useful for you. Thank you for your interest and attention, and until the next tutorial. Helmut Pilhar, father of Olivia,